What is a pain management consultant, Harry?
It's a really good question, because pain management is fairly misunderstood, even amongst medical specialties. But a pain management consultant is somebody who's undergone specialist medical training to diagnose and manage a wide variety of painful medical conditions. We employ a huge variety of treatments, from targeted pain interventions to the skill set of physiotherapists and using advanced medication management. But it's providing a whole package of care to enable people to live the life they want to live and enjoy life more.
And what is it that you enjoy about coming to work here at Clifton Park Hospital?
I think pain is a universal thing, right? People suffer with pain from time to time in their life, and it can have huge negative impacts. And I think as a pain consultant, having a skill set to directly benefit people who are in that place where they're really suffering with pain.
So we hear the term pain management a lot, but what do we actually mean by that term, and is it just medication?
It's a really good question. Historically, people have this perception that pain management is just having a pill, it'll mask the pain, make you feel better maybe a little bit. But we've seen so often that these medications that we use so often come with side effects. They can be helpful for some, but people find that there's a lot of side effects. Pain management is so much more than that. It's a whole suite, a raft of different interventions that we can utilise to really give people a great degree of pain relief. And we also involve the expertise of people like pain specialist physiotherapists and occupational therapists where needed, to really provide a package of care that helps people go from being in pain that's limiting their life to a place where they can better engage with life in a fulfilling way.
Chronic pain is invisible a lot of the time. It can't be seen. So when people come and see you, how do you help them be seen?
That's so true, and it's a huge problem, isn't it? Pain is totally invisible. The only way you can really convey it is by trying to describe your pain experience. But that's so hard. Even describing your pain to loved ones, they can't really understand. And even to medical professionals, your GP or another specialist, it's very hard for them to get a grasp of your pain experience. But as pain management consultants, that is our area. And we really want to listen to patients to understand their painful experience as the starting point. And from there, we can examine, investigate, and really try to diagnose the root cause of that pain. And then go on to provide a targeted, tailored, bespoke management plan to help them get in better shape and relieve their pain.
And can you tell us about some of the most effective pain management treatments there are?
Well, it really depends on the precise cause of that person's pain and where it is in their body. But there are targeted specific treatments for each individual pain. For example, something that might resonate with a lot of listeners would be low back pain. That severe, dull, aching back pain that can stop you from walking any distance, stop you from sitting for any length of time, limit your activities at work or at leisure. And yes, there are lots of interventions available for low back pain. For example, we can do facet joint medial branch blocks. A very common cause of low back pain is facet joint arthritis, wear and tear. So we can block the nerves, taking those pain signals from those little joints in the lower back, give some pain relief, and that really helps us diagnose the problem. Then we can go on to provide longer lasting pain relief with something called facet joint radiofrequency ablation, which is a treatment which I would hope provides longer lasting pain relief of many months to a year or more, and can be repeated if necessary. Another example might be sciatica, so that pain that shoots down the back of your leg or both legs, a really sharp electric shock type pain. It's usually caused by irritation of the nerves in the bottom of your back. And we can put a targeted injection of local anaesthetic and anti-inflammatory medicine around that irritated nerve and settle down those pain signals, and hopefully provide a window of pain relief where you can engage with rehabilitation, physiotherapy, and get back being where you want to be.
And you see lots of people all the time, you help lots of people, but can you tell us about one particular example of a great success?
Yeah, I mean, these successes are the reason why we do what we do. For example, I saw a lady a few weeks ago who was really struggling with low back pain. It was limiting her in multiple ways, unable to do the gardening that she loves, unable to go out and see her friends. She felt her life was just getting smaller and smaller. And she came to see me, and we had a consultation, did some investigation and diagnosed her with facet joint arthropathy. We did some test injections and then did the treatment. And she came back a few weeks later and said her life had been pretty fundamentally changed. She's able to go and see her friends, enjoy gardening again, go for walks. And these may sound like pretty small things, but for that individual, it was a huge transformation. And I think that's what the most rewarding thing is, taking people who feel pretty helpless in their pain situation and using some of the knowledge and skills that we have to bring them back to a place where they can enjoy life again.
And the best advice for somebody who is like the woman you've told us about, who's in that place at the moment where they're limited, they can't do things they want to do, what would be your best bit of advice to that person listening?
It's never really one thing. It's never one solution. I'd always say start with the basics. Things like try to eat well, sleep well, gentle, regular exercise. That's the basis, the foundation for a good overall well-being. And it's stuff we should all really be doing. We know we should be doing it, but when you have a significant painful condition, it's a real struggle to do those things. So what I'd say is try and do those things, maintain that. But if you're really struggling, come and see a pain specialist early.
So for someone listening to this who wants to come and see you at Clifton Park Hospital, what's the best thing to do and what does it look like?
Thankfully, it's fairly straightforward. There's a couple of different ways you can do it. Either you can call the Ramsey Hospital Clifton Park directly, and they'll be able to arrange an appointment with one of our pain specialists at York Pain Group. Or you can go to our yorkpaingroup.co.uk website, and our secretary details are on there, and you can call them up and they'll be very happy to arrange an appointment for you here at Ramsey Clifton Park.